Initiating cooling at Tertiary Care Center.
As the patient arrives from the referring hospital, we need to confirm that the infant meets criteria for therapeutic hypothermia. They need to meet the inclusion criteria we discussed previously. They have to have an abnormal cerebral function monitor or full 20-lead EEG read by neurology, a neurologic exam, and neurology needs to confirm the need for therapeutic hypothermia. And then we place an esophageal probe, and this is positioned 2 to 4 centimeters above the diaphragm. This probe can be placed immediately upon arrival if the team is highly suspicious that the infant will meet criteria. By placing the probe earlier, there's tighter control of the patient's temperature. There are several equipment choices on the market for providing therapeutic hypothermia. Some examples are the Olympic Cool Cap, which is for selective head cooling, the Criticool with Cure Wrap, which is a body wrap, and the Cincinnati Sub-Zero with Jelly Roll Blanket for total body cooling. Here at our institution, we utilize the Cincinnati Sub-Zero Blanketrol 3 with Jelly Roll Blanket. Once you identify the patient meets inclusion criteria, we begin by initiating our cooling checklist. Our cooling checklist is very detailed. It includes how to set up the equipment, how to initiate cooling treatment, how to jump to maintenance phase of treatment if your patient arrives at goal temperature, as well as what to do when your therapy is interrupted, such as going to MRI. All setup and changes are performed by 2 RNs. Our overall goal is to get patients to goal temperature within 6 hours. The target temperature we aim for is 32.5 degrees to 34.5 degrees, with the goal of 33.5. Now that we've reviewed the cooling checklist, we'll move on to the nursing assessment aspects of caring for a patient with HIE.